Hello everyone, this is Tony Reale with Baseball Rehab Expert. Today we're going to discuss the criteria to initiate a throwing program after having Tommy John surgery. So how do you know when you're ready to start a throwing program? It's very important to have a good base of support, general training foundation with strength, stability, full range of motion, no pain obviously. You've attacked the rehab, you've done all your proper arm care, cleaned up any energy leaks throughout the entire kinetic chain. It's important to do all this to make sure that we've attacked this so we place the least amount of strain on the elbow as we begin to throw, because we do know that time from surgery is not a prime indicator. There's going to be people that are not ready to throw at 6 months prior to not them attacking their rehab correctly, not addressing some of the limitations that they've had throughout their kinetic chain that'll add increased stress to their ligament. Want to make sure that their overall movement capacity is high, that they don't lack any scapular upward rotation. That way when they go to throw, lift their arm up and throw, that they're able to get their arm up and they're not dropping their elbow, placing increased strain on that. That they have good anterior core strength in all three planes of motion, that they have good lat extensibility, that they're strong and stable in all three planes of motion, not with just their core and shoulder, but also with their lower extremity, that they have good single limb balance, especially as a pitcher as they stride. They want to make sure that we're able to transfer that kinetic energy from the lower extremity up all the way through the core into the elbow. So the elbow is the end of a whip. They have symmetrical shoulder motion, so we know that there's a huge correlation between shoulder internal rotation limitations and elbow UCL insufficiency or increased stress, as well as total arc of motion with their dominant arm versus their non-dominant arm, which we've discussed in prior PowerPoint presentation, as well as flexion. We need to make sure that they're able to raise their arm overhead without any type of limitation, as that has been researched to show that that can increase your risk of elbow injury. All in all, we just want to make sure that we're looking up and down the whole kinetic chain to limit the stress on that distal elbow. Again, this is important prior to throwing, coming back from an injury, but it's also important from a healthy person. We know that going through an entire baseball season can be taxing on the body, as well as decreasing some limitations, as well as your strength throughout. Want to make sure that when we shut it down the off season, that we're addressing some of these limitations prior to throwing and picking up a ball in the off season, getting ready for your following season. So after we've done that, we've have a strong base strength. We want to make sure now we move towards the specific training that we do in order to gear up towards baseball. And that starts with the two-handed plyo med ball program. Again, we're going to start with doing a little bit more ballistic speed type work. Once we do the two-handed ones, we're going to go to the one-handed plyos. We'll discuss the weighted ball program routine as well, as that's a hot topic right now. Some towel drills, and then the throwing program will go into a little bit of detail on flat ground side work, and then some infield outfield drills as well. So you can see from a two-handed plyo, again, prior to progressing to this position, we want to make sure that we've addressed all those deficits that we discussed earlier. We're moving on to facilitating some fast twitch muscles, increasing some power as well as endurance in this. You must be pain-free. That's more important. You want to make sure that there is no issues while you're performing this exercise. We typically do this for 4 weeks prior to initiating a one-handed ball program. We usually start out somewhat slow, as you can see in the video, and then we'll go ahead and progress faster and to increase sets. So this is a two-handed chest pass. Again, he's going to start by going nice and slow, making sure he's receiving the ball and exploding, and then continue to work faster as he starts to feel more comfortable. And then we're going to also do overhead throws. You can see again, one of the things that we're doing as he goes overhead, if we didn't have good lat extensibility, we'd be increasing some stress on the elbow as well as the low back in this position. So again, prior to doing this, we want to make sure that we've cleaned all that limitations up. Typically, we start the two-handed plyo med ball program from a Tommy John perspective at 16 weeks post-op. Again, Typically, that gives us 4 months to clean up and address all the limitations. That should be adequate enough time if you're attacking your rehab correctly as well as attacking the gym. The other two-handed plyos, we're going to do rotations. So again, we're going to do this from both sides to make sure there's symmetry, but you can see how he's starting out nice and slow, and then as he begins to feel more comfortable, he's going to speed that up as well. After we've done 4 weeks of the two-handed plyo med ball program, we're going to progress to the one-handed again. So now they've had no pain with two-handed plyos. They've increased their speed, no issues. We're going to go to one-handed plyos. Again, typically at their 5-month mark, if they've addressed everything. It's important to note that from a plyo med, any type of plyo med, we want to make sure that we're not doing them every day. We're doing these typically in the program Monday, Wednesday, Friday, so there's a day off in between to recover. You can see in the video to the left, he's going to work on that posterior cuff, working on that posterior shoulder joint while we're completely exploding. And then on the other side, we're going to do internal rotation. So again, this is the most stress that at this point that we'll have placed on that ligament. You can see how as the ball brings his arm back, we're going to be gapping or creating stress on that medial elbow. So this is important. We want to make sure that we are noting that we're not having too much soreness while we're doing this, and see how they respond, especially after their first time. After they've done those, we're going to get in the bring the arm up, and now we're going to go into a 90-90 position. So again, typically UCLs tend to have trouble in this 90 position, end range cock in, lay back into early acceleration, as when the elbow starts to gap and place the most stress on that ligament. So again, we want to make sure that we're not having any pain, and then we're going to go into a regular throw. Just for video purposes, we're a little closer to the trampoline than I normally have people, but you can see it's a regular overhand throw as much as possible. Moving on to the weighted ball program. Again, we want to make sure that we've built a good base of support, general foundation of your eliminating any energy leaks. We have full range of motion. If you're not, you're really flirting with the force velocity curve. If you try to do this type of workout prior to making sure that you have a good base of support, you are leading yourself to an increased risk of injury. Again, not all clients will be a candidate for a weighted ball program. People that have tight shoulders or too loose shoulders, somebody that is kind of skinny and doesn't have a lot of muscle mass. Again, it needs to be a perfect fit where the athlete has a great foundation with really no limitations in range of motion, strength, or stability. Because we do go up to a 7-ounce ball in my program anyway, which doesn't seem like a lot since a regular baseball is 5 ounces, but that is a 40% increase in a regular baseball. So that is significant if you put that into your bench, if you were to increase 40% in your bench. So it's something to be mindful of, and not just to go out and throw heavy balls without consulting somebody that can ideally clear you, seeing that if you're an ideal client. So here's a weighted ball program that I've used with some of our guys. There's phase 1 on the left and phase 2. So going over some of the research, we do know that some of the lighter balls are going to increase or produce higher elbow and shoulder angular velocity, so increase stress on that ligament. So you just got to be careful on the lighter ounce balls, but that does help train the arm potentially to move faster and develop quicker arm speed. Obviously, the 5-ounce balls is the size of a regular baseball, and again, the 7-ounce ball is heavier weights. That decreases the kinematics of the throw in motion, likely increasing the kinetics on the shoulders and elbow joint, which can aid and help with the speed strength continuum that is involved in throwing a baseball. So typically, how do I do this? I have them throw it from about 10 feet away, usually make a strike zone on a wall through tape. That way they're working on their fine motor skills and feeling their release point and trying to throw a strike. So there's some intent while they're performing the weighted balls. Again, it's not everybody's a candidate. I don't use this on every single person that has Tommy John. Just wanted to throw it out there just because I know that it is a hot topic and there's a lot of programs out there. This is one that I've used with a bunch that appears to be safe, pending you've done everything that you need to do and decrease that. So, not everybody is able to do this. So, why did I initially add the weighted ball program? The main goal for rehab is to minimize the gap from the training and the weight room out onto the field. So as you can see on the video on the left, this is the regular trampoline throw. You can see as my arm goes through that throwing motion, it's pretty slow. I have to kind of recoil a little bit because I'm trying to catch the ball back off the trampoline, not really finishing your throw, not really great for setting up mechanics. Whereas you can see with the weighted ball on the right video, my angular velocity and my arm speed going through that motion is way quicker and way more like similar to a throw as I would on a flat ground. So that's something that I've seen like bridge the gap a little bit between rehab and performance side. I feel like that it's been way better to try to eliminate some of that rehab throw where people start to lead with their elbow. They're a little bit timid. They feel like they're still a threat at their elbow. Obviously, most guys hurt their elbow when they're throwing, so they're conscious of that when they go to start throwing. Throwing the weighted ball is not outside. They don't have a glove on. Seems like it's more of an exercise as opposed to throwing, so kind of decreases some of the fear at times with some of these guys, I believe. Another way that you can increase some of the arm speed and then obviously work on some of the mechanics as well as through towel drills. So working potentially with a pitching coach prior to getting on the mound and throwing your bullpens. You can work on some of your mechanical type flaws that you need, whether it's stride length, making sure that your front leg is pointing towards home, making sure you're not opening up or flying open on that back hip. A lot of things that you can work on that potentially could help you. Again, towel does have some weight to it. It is going to increase some stress, so we want to make sure that we're cognizant of frequency and how many times a week we're doing it, how many sets and reps we're doing it throughout the week. It's something that I don't think you should do every day with all the other stuff that we're doing to place stress on that elbow. So again, from a clinician standpoint, obviously we ask athletes all the time, hey, how are you feeling? The answer is, I feel great, no pain at all, best I've ever felt. Obviously, we know athletes tend to lie at times. They want to, rightfully so, they want to get out there with their buddies, with their teammates, back out on the field as quick as possible. So they're trying to grind through some of this because that's what they do during the season. So some of the ways from a clinician standpoint that we can kind of assess that, we can do their normal pre-shoulder throwing or stretch. Obviously, we know if we're doing it routinely what their normal shoulder feels like. If there's a little bit of extra tightness or limited range of motion, we know that they're probably fighting some inflammation, maybe some impingement type stuff from a shoulder perspective. See if there's any apprehension or wincing while you're doing this type of stuff. You can check O'Brien's test, coming across, thumb down, checking to see how that posterior cuff is controlling that humeral head, if it's in the middle of the glenoid or if it's obligated to the top superior aspect creating impingement. We want to make sure we're assessing that. And then from an elbow standpoint, from a Tommy John's especially, we want to test it valgus-wise, see if there's any pain or wincing, as well as a valgus extension overload bounce home test, seeing if there's any heating up or pain in that back of the elbow prior to throwing. Obviously, if there's pain with this, we probably wouldn't allow them to throw that day. So something to just kind of objectively put to see if they're ready to throw. So again, we've done all the things. We've have a good foundation, no energy leaks, no limitations, range of motions, good strength. We're ready to start throwing. Throwing is typically a 3-day-a-week deal. So again, step 1 on Monday, we're going to throw. Typically, I use the 48-hour rule. So Wednesday, step 2, if they still have some soreness, we're going to go ahead and bang it. We're not going to throw that day. We're going to skip that day, and we'll go ahead and wait till Friday to throw. So again, we don't want to stack soreness on top of soreness. If we take a day here or there because of the soreness, that's way better than having to take the stand and 8 count for a few weeks, or worse yet, if we do some damage to the ligament, we might have to be down for a lot longer. So again, we spend a little bit more time at 90 feet because that's, and as well as 120, that's where people tend to have their hiccups. This is phase 1 continued. Again, if you're a pitcher, you go down to step 18 prior to throwing off the mound. So again, you can see I only allow guys to throw up to 120 feet prior to getting on the mound. Stresses do appear to be similar to throwing 50 to 60% on the mound thrown at 120. With some of the research done with Modus, we know that them throwing out to 180 feet or beyond is similar to throwing a live VP. So clearly, we wouldn't want them to throw out that far and long toss at this point. We haven't even gotten them on the mound. So you can see a position player, they'll go up to step 19, 20, and 21, getting them out to 150 prior to them being able to start doing some infield, outfield drills. So here we'll go through a throwing progression. You can see this is having somebody warm up. They're doing the 2-out drill. We do know with some of the work done by Reinhold that with every throwing event, they tend to have limitations with internal rotation as well as elbow extension and shoulder flexion. So this drill was performed for pitchers that were going back out. So they're in the dugout. They've just pitched the previous inning. Now there's 2 outs on the field. They do this as a warm-up, and evidence does show that they did revert back to their normal range of motion prior to throwing that previous inning. That way there's no limitations. That way we're not stacking soreness on top of soreness or decreased motion on top of decreased motion. So you can see starting out at 45 feet, he's just kind of getting the cobwebs out of the shoulder, throwing nice and easy, but still mechanically sound, solid off that balance point or that back leg. You can see how his body weight is going towards the target. You can see how he's focused. There's intent with every throw. He's working on mechanics. He's working on his follow-through. He's not just going out there and kind of going through the motions. As you start getting back closer to 90 feet, we want to make sure that we are taking a crow hop, using our legs. We're not just going to stand flat-footed and throw with all arm and core. We want to make sure that we're using those big leg muscles that we've trained. Moving back out to 20 feet, again, crow hop, having all of his body weight go towards home plate. You can see how he crosses over. He's going to do a nice crow hop, get those legs behind him. He's going to use that front arm, and he's going to follow through really nice, and everything, all the momentum is going towards his target. And we can see that from the posterior view too. Again, you can see how he's concentrating, looking at his target. He's moving forward, and then everything is pointing towards his target. Good follow through, good mechanics, good intent with every throw, getting a lot of good work from his throwing program, not just kind of going through the motions. All right, so phase 1, from a pitcher standpoint, we went through 18 steps. Now we go ready for phase 2 to throw off the mound. Off the mound, we're going to throw twice a week, so there's going to be side, and then we're going to have 3 days off in between. Again, some of the research done shows that after every throwing event, it can take up to 72 hours for you to revert back to your normal range of motion measurements. So we want to make sure that we're able to do that, so we're not placing added stress or creating any energy leaks while we're doing that. So again, step 1 on Monday, then we would do step 2 on Friday, and throw in between. And again, step 2, phase 1 is gonna take about 9 weeks if there's no hiccups or missed days. Phase 2 is going to take 10 weeks prior to us throwing our live VP. We're going to throw, you can see how it's 50%, and we move up to 75% prior to throwing 100%. And then once they throw 2 live BPs, that's when we think they're medically cleared at that point to throw off a game. This throwing program is for a starter as well as a reliever, so they go through the same program up until they throw into a game. So clearly at this point, a starter will go 2 innings, then work its way up to 3 innings, 4 innings, 5 innings, work up to his pitch count. Whereas a reliever would start to throw with 1 inning, have 3 days in between, and then kind of shorten the gap to 2 days, 1 day, and then eventually throw back-to-back if that's something that they're going to be asked to do during the season. So when do you mix in off-speed pitches during rehab throwing? So phase 2, again, once you start throwing off the mound, you're going to throw fastballs only, but on flat ground in between your side sessions, you're going to be able to start mixing in some change-ups, some cutters, and some two-seams. And then as soon as you start throwing 75% off the mound in your bullpen sessions, that's when you can start mixing these in on the mound. Typically, I usually have them mix in about 20 to 25%. So if they're throwing 40 throws, again, you're looking at 8 to 10, 8 to 12 throws of off speed. The rest of them are going to be fastballs. When would you mix in sliders and curves? Again, once you throw 75% off the mound, in between you're going to start utilizing these on flat ground. And then as soon as you start throwing 100% on the mound, then you can start mixing these in on the mound. So again, your fastball is going to be at 100%, but you're clearly not going to just start yanking sliders and curves when you haven't done it. You're going to start flipping them in there nice and light, and then gradually and slowly continue to yank it down a little bit more firm. Again, other things that we need to have a pitcher do, we're going to have to make sure that they're doing stuff that they're going to be asked to do. It's going to be bunts that they're going to have to do. You can see how the importance of setting your feet and throwing towards a target. This is something specificity for a pitcher. We're going to have to make sure that we're having them do this prior to releasing them to game. Some deeper specificity with position players. Again, we're going to have to make sure that they're going to throw with different arm slots. They're going to have off-balance throws, throws as well. Things that they're going to be asked to do on a game in the moment that they're not going to think about. We're going to have to make sure that we practice those things. That way, when they get in and they're asked to do it, they're not thinking twice and their elbows already felt it. There's not going to be any added stress or tweak. So again, slow roller, throwing off one leg across their body, clearly, mostly core and arm. We need to make sure that we're doing that safely to start and then eventually increasing that prior to game action. And then you can see it kind of in live. You can see how here he sets his feet, drops his arm down. And then on this next ground ball, we can see how he kind of throws across his body, doesn't really have his lower extremity underneath him, throws mostly with arm. So again, things that are going to increase stress on the elbow, we need to make sure that we practice. So in conclusion, we need to make sure that we're cleaning up any and all energy leaks in the kinetic chain prior to throwing, increase in strength, good foundation, decrease in the range of motion limitations, and obviously making sure that there's zero pain as we go through the two-handed plyos and the one-handed plyos prior to throwing. A trend that I've done for over 10 years now is I've waited longer to initiate throwing programs. I'm not a big fan or advocate of throwing at 4 months. I typically throw at 6 months post Tommy John. Again, time from surgery is not the prime indicator of when to start. However, I think it takes a solid 6 months to make sure that these guys are in a good position. If they attack the weight room, they attack their rehab, they have 6 months where they put in the good work on the front end. Typically, they have less chance of setbacks on the back end, and we can kind of move quickly through that throwing program, in my experience. Again, we want to monitor symptoms throughout the progression. It's not completely abnormal to have symptoms, especially as you start to throw, place some of the increase or added stress on the elbow. We want to make sure that we're abiding by that 48-hour rule. We're not stacking soreness on top of soreness. We want to make sure that it's okay to be sore, but by the time we pick up a ball again, we want to make sure that the soreness has subsided. And we want to make sure that we take into account the different position-specific throws that need to be done. So again, in rehab, we want to make sure that we're bridging the gap, we're decreasing the spikes, that we're making sure that we're Anything that they're asked to do on the field, we're practicing with them either in the weight room, the training room, or on the field prior to releasing them and clearing them medically prior to game action. Thank you guys for sitting through the last 20 so minutes. If you have any questions on Tommy John rehab, about any of the throwing programs, or about purchasing any of the programs that are offered here on www.baseballrehabexpert.com, email me any questions that you have. I'll get back to you as soon as I possibly can at info@baseballrehabexpert.com.